So my name is
What
Saro,
level
Dr.
have you gone
Abdikin.
to?
I'm a second-year medicine resident interested in cardiology. We got a call.
Yeah.
We were on call today from the medicine service,
Okay.
and we had a STEMI come in. This is a 78-year-old male. He's a type 2 diabetic. No recent baseline labs, but his A1C was 6.7 in 2019. He's a hypertensive, hypothyroid, and hyperlipidemic patient. His last known EF in our system was within normal limits without any significant valvular abnormalities. This was about 4 years ago. As of recently, home medrec includes spironolactone 25, Lasix 40. There's no beta blocker or other GDMT meds except for benazepril 20. He's on levothyroxine 50 and Crestor 5 at home. Okay, great. So we have a 1 AVL and V2 ST elevations with depressions in 2, 3 in AVF. So he's on the table now getting an Impella. And as I'm sure you guys know, Dr. Carr had another case that he was going to do, but the STEMI rolled in, so it took precedence.
So we can see how sick the patient is. So can you see the fluoro? I've put in an Impella. Can you describe, Sarah, what I've done? Sarah?
Yeah.
Can you say what I've done? Let me focus on the patient. Can you say what I've done?
Oh, yeah. So Dr. Carr has put in a Impella so far from the right groin. EF is really low with some hypokinesis going on. Global hypokinesis.
His EF is 20% on a bedside echo. I put an Impella in first. That I think the right thing to do. Now he's got a P100 full support. I'm now doing the first angiogram. Can you show the picture? The right is okay. The right shows no major blockages. So that's a CLS3, which is not going in. I'm having a problem. Do you have a 3.30? This is a 3.0, right?
I think so. Yes.
Test. Oh shoot. Okay. Good. Your wire. Keep your JL 3.5 ready.
Here's your wire.
Can you increase the mag for this and bring this table closer to me?
Table closer.
No, the II closer to me. II closer to me. Can you not hear this monitor?
He wants the monitor closer.
Closer to me.
That's as close as it can get. Okay. And then what was the catheter you wanted, Saibal?
A 3.5.
He wants a 3.5, FL 3.5. Yes.
Yeah. Just kidding, I felt 3.5, but this is not going in. This is the 3.0, right? Yes. So we're having a problem with the 3.0. I can't make him breathe. It actually went in for a second. And I now, no, it's attached.
Okay, I'll take it. No, that's a 3.5. You want a 3.5, Saibal? 3.5?
Let me see. FL 3.5, yeah, let's try that. Yeah. Can anybody hear me, guys? Hi? Yeah. So the patient's blood pressure is now the 90s. He's in sinus rhythm. We're still having a problem in engaging the left. We had engaged it for a second with the diagnostic catheter. Now I'm trying to get it with a guide. I first decided to support him. This is a 3.0 CLS guide catheter. I'm having a little bit of a problem, even with the CLS3. Can you test, Kirk?
Right, test.
Yep. Okay. It's just he can't take a deep. So can you take a deep breath?
There it is.
Take a deep breath. Test.
Richard.
Okay. Breathe normal. Test. Test now. Test. It doesn't go in, man. I'm just having a difficulty in getting it. Okay. Let's get a 3.5. Okay.
3.5.
Okay. Can I get the guide? Exchange link wire. The other way, please.
This,
To the softer end, right?
is that the soft?
Yeah. So we are changing for a JL35, and I'm going to go from the right radial. I've got through the right groin. I've got an Impella. He's very obese, so hold the sheet, okay? And a very short neck, which makes it challenging. But I managed to get the radial axis in presence of hypotension. And now I'm just going to exchange the guide and see what we can do. In the meantime, we've given how much of heparin total? Hold the sheet.
5, 7, 12,000
12,000. Was this a 3.0 or was it a 3.0 or 3.5?
CLS.
Is it CLS 3.0 or 3.5?
Yeah, I gave you a 3.0 and
Okay.
I gave you two. I gave you a 3.5 and a 3.0.
Okay, got it.
The first one.
And then I'll take a 3.0.
Yeah.
All right.
Thank you.
So let's get this in, and let's get the stopcock on that one. Did this?
Yeah, you want that on.
No, no,
down
no.
here,
Yeah,
right?
get it. I'll get the wire. Yeah. I'll get the wire. No. Don't take it off. Yeah.
Sorry.
So we're trying to get access through the right radial artery. We're having a bit of problem. If it doesn't, we'll have to prep the left groin. But keep going.
I got one.
Can you put this on? Put
Okay,
this
yeah, I
one.
got it.
Yeah. Sorry, no, it's okay. He's just doing this. Wait, one minute. Good. Okay, flush it.
Flushing.
Are you okay? Okay, good. Go. Advance. Yeah, good. Stop flushing. Stop flushing. Yeah, it's okay. Everything's going all right. How's your chest pain? 6 out of 10 chest pain. Okay. We're going to help you now, okay? Okay, stop it. Yeah, good. It's going to be very difficult with the Impella there. It's actually very difficult to now engage the left. And this is even with a 3.5 I'm not managing to do. Okay. Yep. Yeah, we may have to go from the groin. Or do you have a CLS 3, GL3? Did you hear me, Kathy?
CLS.
No, it's GL3. Yeah. Oh, man. Just see if there's a JL3 because this curve is not helping me either, especially with the Impella right there. All right, just good test here, please.
Ready? Test.
Oh man, this is not good. You got an FL3?
There, that's it. Look at your
No,
in.
but it's not a good position. Sitting. Just take a sitting.
Go ahead.
Okay, so just see if you got an FL3. Otherwise, I'll have to get access from the groin because through the right radial, it's actually very difficult to get access from here. The curve is not. The good news is there's flow in the vessel. Do you have you gave me a CLS 3, right?
Yeah, we have a 3 and a 3.5. We tried both of those. The first one was a 3.5, then the 3.
Yeah, this is just not the right curve for this test. Test. No.
You want to go through the left groin?
We may have to go to the left groin. Yeah, get the left groin ready.
Back under pressure. I think I still have the sheet.
You don't have a 3, right? Do you?
We go looking for it. Gabe went to go get it.
It's just not the curve for this guy. You know, he's got a very short. I went to the right radial, which I normally do, and now I can't. Yeah, this curve is just not helping. Get a guide wire. So Amar, this is a guy who's got left main disease. I'm having a problem getting gaining access to the right radial artery. The right's okay, yes. Yeah. So we got right radial access, and Impella in, and we're injecting contrast. And then you can see there's STEMI flow in the LAD, but there's a very high grade complex left main stenosis. And the AV groove is bad. I just think, Amar, do you want to come and see? I still think he should be a surgical candidate, unless people think otherwise. Because if he don't, we have full support, but he has good flow in the vessel. You see that? And so we like this idea. So we would just like to wait a little bit, see what the surgeon says, because now we have good flow. Okay, let's do a angiogram. Yeah, good.
Yeah, that's it. That's what I want.
Patient is fully heparinized. Yes, so there's a high-grade stenosis in the LAD is patent and TIM3 flow. There's a 90% stenosis of the left main with dissection. And then there's a circ that's coming off. We have a little problem in getting the guide inside, as you can see. With a little difficulty, I have got it in. It was actually the only option was to do a radial approach, whose legs vessels are quite tight. I'm just doing one spider view just to show people. And Amar, Amar, did you see it?
Yeah, I see it.
I mean, his flow is okay with the vessels.
Okay, want me to mobilize?
Yes, you should mobilize the team. Fluoro? No, fluoro, yeah, good. Okay, ready? So it's a very complex plaque, and I can do it, but I think he's got flow through. What do you think, Amar? He's a surgeon over here, and he's looking at the patient flow. The right is absolutely okay. His blood pressure is now 90 by 62 and 72. His heart rate is 94, and his creatinine is normal. So I would actually opt for considering of a surgeon. 2.5? 2.5 is creatinine? So his creatinine is 2.5. Did you hear that? Amar, did you hear that? Okay, let's do one more test, contrast. So that's actually making it going to be very hard. I mean, this is a hard case to make a decision as to what we should do.
Omar said it's definite surgery.
Okay. He's okay with that? So the surgeons are willing to take him to surgery. I think this is a true heart team decision. We have very good flow in the vessels. We have an Impella. His LV function is actually not good. His blood pressure is he on inotropes? So he's on norepi, and he's pulling, and he's getting. How much is he getting in the Impella? Okay. Yeah, we're done chloro. Did you hear his creatinine? And he was doing well till yeah. All right, so his pressures are okay now. I think we should. The patient's okay with it, sir. We'll most likely consider you for open heart surgery. You have a very severe narrowing of your arteries. Okay.
Is it totally necessary?
If you don't make it, you will not survive.
Sounds like
How's your pain now?
4.
4 out of 10. So his pain is a little bit better. I think he's got good flow in the vessels. I just given him IV heparin. We'll actually give him 4,000 more heparin. I would take the catheter out now. So Amar, I'm going to take the catheter out. Can we give you a wire? So
Here, use this.
They're small. I mean, they look smallish to me. LED, and he needs like a Venus or a Cirque. Whatever. I think basically whatever you see, we cracked. It's one of those. Okay. Schump. SCHUMP. Do you want to do this, and you want me to do this? How do you want to?
Thank you.
That's fine.
Is patient gonna stay here and then we're gonna use the line or then we're gonna go back?
no, it's okay. We can do it. No, don't cancel it. What's the time now?
Do you have another STEMI meeting?
There's another STEMI?
Yeah.
And is the patient going to come here or there? Okay. All right. So we are going to we are planning to take him to surgery. He's clinically stable now. His pressure is yeah.